We were leaving Kuwait, headed to Iraq. Something happened to one of the trucks, so we pulled over. I got out of my truck and started to help them change the tire. That's when we think a civilian driver hit us, and he just kept on going.
It happened on December
19.
2004. And they took her to Walter Reed. And she was not responding or nothing. And they wanted to take her off life support. And I was thinking maybe we should. But her husband said no.
So he kind of saved me.
Yeah.
I think the interesting thing about trauma and traumatic brain injury is that it is indiscriminate. Anyone, anytime, anywhere can be equally vulnerable. Data has always been a part of my research and my interests. I'm also very interested in biases in our healthcare system, and I wanted to make sure that we were not intentionally or unintentionally limiting access to any segment of the population. And so as routine, I called my team to make sure that we were quarterly reevaluating our data. And that's kind of what led us down the path of saying, wow, are we really understanding wholly the experience of female patients?
The psychologist said, you know that she's not going to recover. I just want you to be prepared for it. I don't want you to have any hope. So just be prepared. I cried that day. For some reason I knew, I'm a mom. I knew that it was not the end of it.
So when you look at the reports and the data that looks at traumatic brain injury in the military and veterans, and even in the civilian population, 95% of that data is males. And if women are included, they are actually included as part of the cohort and they're not analyzed separately.
Our treatment strategies and management strategies and funding decisions were being based on what was being published in the field. So the first question was, is the field reflective of the experience of this subcohort? And what we found was really quite interesting. Women tended to be more likely to be unemployed, more likely to be homeless, and we also found that they were more likely to be better educated than their male counterparts. We found that women had more somatosensory symptoms than their male counterpart, more vestibular symptoms than their male counterpart. It was not as if their experience was so incredibly dissimilar, but it was the nuances of that analysis that really stuck out to us.
And we wanted to show that the difference between men and women is because of their gender and not because of the differences in traumatic brain injury. And what we found, surprisingly, was that there was a moderate sex difference on the symptoms overall, but there was a significant effect on cognition. Women reported having more cognitive problems than men. Since then, we've also looked at certain differences in cortical thickness of the brain. The thickness of the cortex has been used in neuroscience to correlate with certain things like verbal memory and other types of memory and executive function and other neuropsychological tasks. Well, after brain injury, what we found is that there was cortical thinning that happened in women that did not happen in men.
Then we actually sat down and said, is there a brain behavior component to this, right? Could there be some correlation with the functional findings that we are seeing?
She was screaming all the time, 24 hours a day. But I had to fight with her husband because he did not want her to have any therapy. So I repeated, Mariella, You are not in the accident anymore. You are not in Iraq. You're back in the US. And you're going to be okay. Nobody's going to hurt you. And after 6 times repeating that, she said, okay. The first word.
There seems to be some correlation between function and anatomical differences post-injury. And I think that's as far as we can go at this point.
Right now, we're looking at the mechanisms by which these differences exist, and we are figuring out how we can then target better treatments. Do we have to ask additional questions? Do we have to have different ways of recruiting mechanisms to bring more women in?
My hope is that what our study serves as a foundation for is an understanding that we are all different, and subcategory analysis is important, both in women and in men, so that in the future we don't just assume that aggregate data can speak for everyone without looking at it from the lens of all the different categories that might be impacted.
The 4th of July, 2005, and it was a message on the machine saying, I am Mariella Malin. I'm your daughter. I love you. And I love my brother. And that's it. And I thought I would keep that record forever, but
It's probably gone somewhere.
yes.
I feel you really have to believe in yourself. And you knew, and yes, you have to kind of push yourself to try something new. I hope to get strong again and to be able to walk on my own again with no help, and then to be able to go to school. Yes.
I'm not